Now it's time for your dalteparin injection. I will be giving your injection into your abdomen.
That's fine.
Okay. I'll begin by performing hand hygiene. Select Mabel's EMAR, enter my initials, open up Mabel's EMAR, ensure we have Mabel Smith's EMAR, the patient name, Mabel Smith. Today's date, August the 22nd, 2023. Mabel has no known drug allergies. Mabel, could you state your first and last name?
Mabel Smith.
Mabel Smith. Mabel, may I look at your armband?
Yes.
Mabel Smith. Mabel Smith. PIN 000 000 001 001 010. Scan patient ID. Patient verification is correct. Next, I'll read the medication order to ensure it is clear, complete, and appropriate. The medication name is dalteparin. The dose, 5,000 units. The route, subcutaneously. The frequency, daily. The time scheduled is 8 o'clock. The current time is 8 o'clock. The order is clear because I understand it. It is complete because all the medication components are present. The reason, dalteparin is an anticoagulant to prevent deep vein thrombosis. Mabel is at risk for a deep vein thrombosis related to her decreased mobility following hip surgery. It is appropriate. Mabel has no signs of bleeding, no bruising. I've assessed her blood work. Her platelet count, hemoglobin, and hematocrit are all within the normal range. The dose ordered is within the safe dose range. It is safe to proceed. Open the medication drawer. Obtain the medication. Read the expiry date, July 31st, 2030. Open the supply drawer. Based on Mabel's size, I am going to choose a needle with a gauge of 25 gauge, the length 5/8 of an inch. Read the expiry date, April 30th, 2027. The medication is contained within an ampule, so I will need to have a blunt fill needle which has a filter. I will read the expiry date, January 31st, 2027. I also will need an ampule breaker and a swab, July 31st, 2030. Next, I'll compare the medication order to the medication label. The medication name is dalteparin. The medication on the label is dalteparin. The dose ordered is 5,000 units. The dose on the medication label is 10,000 units per 1 ml. A dosage calculation is required. The dose ordered is 5,000 units. The dose dispensed is 10,000 units times a vehicle, which is 1 ml, equals 0.5 mils to be administered. The route is subcutaneously. This is an injectable form of the medication. I have a subcutaneous needle with a gauge of 25 and the length of needle 5/8 of an inch. The frequency is daily. The time is 8 o'clock. I will barcode scan the medication. Medication is correct. I have prepared the medication. Time to perform my final verification by comparing the medication label to the medication order. The medication name is dalteparin. The medication on the label is dalteparin. The dose ordered is 5,000 units. The medication label reads 10,000 units per mil. Therefore, a dosage calculation is required. The dose ordered is 5,000 units. The dose dispensed is 10,000 units times the vehicle, which is 1 mil, equals 0.5 mils. I've checked my syringe to ensure that I have 0.5 mils, and that is correct. Subcutaneously is the route. I have chosen a subcutaneous needle, which is a 25 gauge. Length of needle is 5/8 of an inch. The frequency is daily, and the time is 8 o'clock. Now that the medication has been given, I'll sign for the medication by documenting my initials and document where the injection was administered in the comment section. Next, close out the MAR to maintain privacy and confidentiality. Perform hand hygiene.